Excellencies, Prime Minister Dr. Daniel Duncan of our host country, Ivory Coast, Dr. Matshidiso Moeti, Regional Director for Africa at the World Health Organization, Dr. Akin Adesina, President of the African Development Bank, our host for today, Ministers of Health and Finance, distinguished guests, ladies and gentlemen. Good morning. My name is Udwa Kamimo. I'm your moderator for today's West African Ministerial Dialogue on Strengthening Public Health Security. It comes at a critical time, not just for the West African region, but the entire continent, coming as it does just months after the last case of Ebola was reported. We know that there is yellow fever reported in parts of Southern Africa, and with fears for what the latest outbreak of Zika means for the continent. This video is a reminder of what we've been through.
Ebola inside the deadly outbreak as the panic spreads across the ocean. Can anyone stop it, and is there a cure? Ebola inside the deadly outbreak. Ebola is named after the river in the Congo, where the virus first appeared in 1976. There have been major outbreaks since then, but never like this.
The things that happen in Central Africa don't stay in Central Africa.
You got it.
Ebola is now an epidemic of the likes that we have not seen before. It's spiraling out of control. It is getting worse. It's spreading faster and exponentially.
Where Ebola's hit the hardest?
It's okay?
Yeah, it's okay.
Liberia, the epicenter.
Not a lot of flights coming into Monrovia, and those that are coming in, they're screening everybody for Ebola.
Surreal, uneasy, in the grips of something awful. Monrovia, Liberia is a capital under siege by the deadliest Ebola outbreak in history. Doctors and relief workers suited up like spacemen make their way through the streets in a race to contain the virus that so far they've been unable to stop.
What government wants to do is to find out who are those that are sick so we can treat them.
How many bodies have you picked up today?
For 11 bodies.
Our hospital is a busy, 45 to 50 patients at any one time, 3 to 5 surgeries, delivering, 4 or 5 babies every day, where we'd see, 150 patients a day. So each of us took our turn seeing patients in the clinic as well. So it was very busy, very full, and very clinical.
They don't realize they are in the midst of the worst Ebola outbreak in history. The problem? This outbreak has come to such a densely populated place. This outbreak was ultimately brought under control. Its isolation made it more possible to contain. But Ebola didn't go away. It may have been as early as December that this latest strain came out of the jungles in Guinea, along the open borders of 3 countries. And when it hit Liberia's biggest city, it exploded with a vengeance. Ebola travels through contact with bodily fluids, blood, diarrhea, vomit. And this is what makes this outbreak so dangerous. In an urban area with people packed on top of each other, Ebola has been almost impossible to stop. The real fear is that it could mutate into a smarter virus, turning airborne. It could infect with a single sneeze, as millions of lethal pathogens fly through the air. In airports, crowded subways, children's playgrounds. A global pandemic that knows no borders.
So with that visual setting of the stage for today's conversations, we will first hear from our eminent speakers and then proceed to a group photo. So we're of course gathered at the African Development Bank's headquarters, and so I'd like to welcome Dr. Adesina to make his opening remarks.
Bonjour à tout le monde. Monsieur le Premier ministre, vous soyez le bienvenu chez vous.
et Madame la représentante de l'OMS aussi, et tous les ministres de Finances et les ministres de la Santé qui sont présents, et les représentants des organisations internationales. Soyez le bienvenu et bonjour. Your Excellency Kablan Duncan, Prime Minister of Côte d'Ivoire, Honorable Ministers, Excellencies, ladies and gentlemen, good morning. I'm delighted to welcome you all to the African Development Bank for the West Africa Ministerial Dialogue Meeting on strengthening public health security in Africa. And thank you all very much for honoring our invitation. Nothing could be more important. The saying goes, health is wealth. Our meeting today is crucial for building resilient health systems to ensure that Africa can deal effectively with public health emergencies and support its economic transformation. A healthy population will translate into increased productivity and drive to sustainable economic growth. Over the past 2 decades, Africa has made significant progress in terms of health outcomes. For instance, child mortality has declined in sub-Saharan Africa by more than 50% between 1990 and 2015. Similarly, maternal mortality rates declined by 40% in sub-Saharan Africa and by 59% in North Africa over the same period. However, challenges remain. The disease burden remains high in Africa. Although progress has been made in malaria cases, declining by 42% between 2000 and 2010, the continent accounts for 88% of global malaria incidence. Also, sub-Saharan Africa faces a deficit of skilled health workers. While the region accounts for 25% of global disease burden, it represents only 4% of the global health workforce. Lack of access to safe, quality, and affordable medicines remains a major challenge. This is worsened by weak regulatory systems and preponderance of fake drugs. Due to high levels of poverty and inequality, access to quality health care by the poor is a major challenge in Africa. Out-of-pocket spending is the predominant source of financing for health care for the poor. The absence of health insurance makes them even more vulnerable to health shocks. Providing financial protection is therefore crucial for poor households who may easily fall into unemployment or lose their wages or experience long-term disabilities. The Ebola pandemic was a wake-up call, and you saw that in the video clip that was just shown to you. I remember when this was going on, I was totally, like the rest of you, totally heartbroken. I couldn't imagine that Africa will not have diagnostic centers. I couldn't believe that primary healthcare assistance was that dilapidated. I couldn't believe that vaccines would be taken and stored badly. People will have to take blood samples and get on motorcycles, and they have to go from the rural areas to the urban centers. I couldn't believe that Africa was at a level where we'll have to ask foreign governments to set up just simply, centers, diagnostic centers for us. It makes no sense. Actually, it made me very ashamed, actually, that Africa could be at that level, that others will have to set up tents in Africa to deal with a major situation, a situation just like that, that basic. It makes absolutely no sense. And that crisis exposed our fragility, the fragility of our public health systems, and the fact that we have consistently underinvested in healthcare infrastructure in many of our countries. We lost so many people. During that crisis, 13,000 lives were lost in Guinea, in Liberia, and Sierra Leone. Families and households were totally devastated. Now that disease, remember, Guinea, Liberia, Sierra Leone, they were actually coming out and doing well in terms of their economies. But as a result of that shock, they went down. And so it was an exogenous shock that actually pulled them down. And the region lost $2.2 billion of GDP as a result of that. The African Development Bank was the first international financial institution to rally support in the fight back against Ebola. providing $300 million for emergency and post-Ebola recovery programs in the affected countries and in some neighboring countries. And I want to, in particular, pay great homage to the president of Liberia, the president of Guinea, the president of Sierra Leone, and the president of Cote d'Ivoire, as well as the former president of Nigeria, and all of the healthcare professionals, WHO, World Bank, and everybody else, for the tremendous amount of coordination that actually was put into this, and the African Union as well, to be able to solve this particular problem. And I think we just have to say never again. It really can't happen again. Now, I remember reading recently about Zika. And I saw that in Cape Verde, the situations there and the other places where this was happening. And for some reason, we are all quiet now about Zika. But Zika is not. It's just quiet, waiting to explode. Because remember, this is seasonal. And the mosquitoes have a particular seasons. And so by the time that we realize what is going to happen, we are going to be hit again. And so we can't be caught napping like we were when we had a situation with Ebola. And that's why, at the African Development Bank, we believe that it is time to build an effective health system that is fundamental to ensuring that Africa can better respond to health emergencies, build resilient economies, and improve life expectancy of our people. Obviously, this must start with greater investment in public health systems for Africa. But if you take a look at the priorities that we set, sometimes the best way to know what you're doing is to decide to look at where you're spending your money. And as we came in today in the elevator, the Prime Minister and the Minister of Health of Côte d'Ivoire were speaking. Il y avait le Premier ministre qui avait demandé, vous êtes en bonne santé? Il dit, oui. Madame la ministre est en bonne santé quand même. Ils sont en train de parler et discuter et tout cela. Mais ce qui est très important, c'est le financement quand même. Il faut le financer. Monsieur le Premier ministre vient de me dire concernant l'approche du gouvernement de la Côte d'Ivoire. D'ici, il va directement à Yamoussoukro avec Madame la ministre aussi pour voir comment financer l'accès universel à la santé. Mais il faut le financement quand même. Ça, c'est très, très important. Mais quand même, si on voit la partie de financement qui a été promis pour la santé en Afrique, on avait dit, bon, on va faire 15% de budget du gouvernement pour la santé. Je ne crois pas qu'il y a plus que 4 pays qui ont fait ça. Mais je peux vous dire que ça, c'est très, très important. On ne peut pas continuer à parler concernant le financement, la résilience et tout ça là. Mais résilience sans l'argent, quel type de résilience ça? C'est pas possible quand même. Donc, il faut faire l'allocation des ressources nécessaires pour le secteur de la santé. The International Finance Corporation estimates that the amount of money we need is a lot. It's $25 to $30 billion to address the healthcare financing gap or investment gap in the continent. Closing this deficit calls for scaling up investments in partnerships, public, private, philanthropic institutions, and development finance institutions like the African Development Bank, and working very closely with World Health Organization that I think are doing a great job on these issues. That's why at the African Development Bank, we are expanding our investments in the health sector. You know that we have invested since 1970 well over $3.2 billion to finance over 200 operations in this particular sector. With the rise in the epidemics and all these health risks, the bank is supporting emergency preparedness by strengthening disease surveillance at regional and country levels. The bank is collaborating with the African Union Commission, other partners, to establish what is called the Africa Centers for Disease Control. The bank will partner closely with the World Bank and the World Health Organization towards the establishment of this center in West Africa. The bank is also committed $14 million towards the establishment of national disease surveillance, alert and response systems for Guinea, Liberia, and Sierra Leone. Furthermore, to address the knowledge gap and promote research and development in the health sector, the bank is supporting the establishment of centers of excellence across the continent, including West Africa. We have invested about $70 million in private equity funds to catalyze over $1 billion of investments to build sustainable and scalable healthcare systems across Africa. These include, more recently, our investment in what we call Investment Fund for Health in Africa with 10 million euros, the Africa Health Fund, which we just supported with $12 million, the Abraj Africa Health Fund, which we just supported with $25 million, and the RX Healthcare Fund with $20 million. These are private sector, because I really believe it's very important for us to get private sector working. If you're going to have a really functional healthcare system, your public and private have to work very well. Africa, ladies and gentlemen, cannot harness its economic potential to achieve the SDGs with a broken healthcare system. We must change the healthcare delivery paradigm and link public health to overall economic development. We must fix the fundamentals. In the absence of electricity, doctors perform surgeries in the dark and rely on unstable power supply. Medicines and vaccines cannot be safely stored without power. Without access to adequate nutrition, millions suffer from malnutrition and stunting. It was the father of medicine, Hippocrates, who said, and I quote, "Let thy food be thy medicine, and thy medicine thy food." With 54 million children stunted, 14 million wasted, and 10 billion obese, it is clear that Africa has a major problem on health that is linked to lack of access to adequate and nutritious food. And as you know, the continent loses roughly $25 billion a year as a result of malnutrition. And if you take a look at it in terms of GDP loss, Africa and Asia lose about 11% of their GDP annually because of malnutrition and stunting. So it is clear to me that when we talk about health, when we talk about malnutrition, when we talk about stunting, we're talking about the economy. And so as ministers of finance, what we've got to be thinking about is the graded infrastructure that we can build. It's not necessarily the road. I mean, we like roads. It's not the port or the rail and the things that we are doing. They're good. The most important thing is what affects your brain, which is basically the gray matter infrastructure. I believe that we must begin to invest in that. That's the most important infrastructure. It's a gray matter infrastructure. I can repair a bridge. I can repair a road or a rail track. But once the neurons in the cells of the brains are gone, that's gone forever. Ladies and gentlemen, with high levels of unemployment and underemployment, millions are unable to afford the cost of healthcare, especially our youths. They are becoming very vulnerable. Pour ça, je dois saluer l'effort de la gouvernement de la Côte d'Ivoire parce que, en venant ici, il y a le Premier ministre qui a parlé concernant l'investissement de le pays pour la santé, accès à la santé universelle. Il m'avait dit qu'ils vont commencer avec les étudiants. Il dit même pour Madame la ministre de la Santé que, bon, il faut commencer là-bas parce que normalement, si les étudiants n'ont pas content, c'est un problème. Donc le Premier ministre a dit, bon, vous avez écouté le président de la base, ça c'est très important. Non, je pense que ça c'est très important. Je vous félicite pour votre initiative. Je sais que monsieur le Premier ministre va parler concernant ça. Ça c'est très, très important. Il faut quand même avoir la résilience, le système de la résilience. Il y a aussi un problème qui est très, très important pour nous, c'est qu'il n'y a pas l'intégration de marchés financiers, marchés de services, aussi l'intégration régionale, ça manque. S'il n'y a pas ça, comment on peut augmenter la croissance économique de notre région? Ce n'est pas possible quand même. C'est la raison pour laquelle nous avons commencé avec ce que nous appelons le top 5 de la BAD. Pour éclairer l'Afrique et donner accès à l'énergie en Afrique, nourrir l'Afrique, industrialiser l'Afrique, intégrer l'Afrique et aussi améliorer la qualité de vie pour la population africaine. Et je pense que tous ces top 5 sont très importants quand même. Quand on parle de la sécurité, de la santé, c'est très important parce que toutes les choses sont liées. C'est très, très important là. So the bank will support African countries to develop sustainable health financing systems and close the health financing gap. In addition, the bank will support policy reforms and put in place conducive, enabling environment for investment in healthcare. Greater investment in private sector and other sectors will be critical, as well as innovative financing models to mobilize increased investments and leverage public-private partnerships. As I close, let me say that I know that we are up to meet the challenges that are before us to finance healthcare systems that will respond adequately to the needs of Africa. The African Development Bank stands fully ready to work with you, the ministers of finance and the ministers of health, to tackle this particular problem and get this done. Let us make sure that indeed health is wealth. For only through universal health care coverage, backed with a sound financing system, can we truly achieve improved quality of life for the peoples of Africa. I'm sure that we can do that. And so let's get on to work on it together and make it happen. And let's make sure we start also from Côte d'Ivoire with a lot of good results. Merci beaucoup.
Thank you, Dr. Adesina. I don't think we've celebrated enough the African-led and owned response to the containment of Ebola. And it's great to see what the African Development Bank is doing, as we recover. Now, it's the job of the World Health Organization to help build better futures for all of us by paying specific attention to our health and healthcare systems. But our weak, Dr. Adesina, you call it even broken health systems get in the way of that. So what does that mean for us here in Africa? I'm sure, Dr. Moeti, you will tell us. Welcome.
Merci beaucoup. Excellence, Monsieur Daniel Kablan-Duncan, le Premier ministre de la Côte d'Ivoire, honorable ministre des Finances et de la Santé qui sont ici présents, le docteur Akin Adesina, le président de la Banque africaine de développement, chers partenaires de développement, mesdames et messieurs, je vais faire comme tous les anglophones qui ont parlé avant de moi, de dire que maintenant je vais continuer en anglais. First, I'd like to thank the President of the African Development Bank sincerely for having invited WHO to be a part of this very important dialogue, taking stock after the tragedy of the Ebola outbreak in West Africa, and going forward with some determination to make sure that what he called our broken health systems start to improve. It is indeed true that Africa bears a very heavy burden of diseases, communicable diseases, and the types of public health events that can grow into an Ebola epidemic. Our countries in the WHO African region, which is 47 sub-Saharan countries plus Algeria, report over 100 new public health events annually. In 2015, there were 105 events which were reported by over 30 of the 47 countries. We have outbreaks of infectious diseases such as cholera, yellow fever, of course, the Ebola outbreak, Rift Valley fever. And these communicable disease outbreaks account for more than 85% of the public health events that can get reported to WHO. The rest being due to natural and man-made causes such as droughts, floods, conflicts which cause population movement and violence, etc. We've seen that the economic impact of these outbreaks is really very high. Aggregate cumulative GDP losses for Guinea, Sierra Leone, and Liberia in 2014 and 2015 due to the Ebola epidemic are estimated to have amounted to more than 10% of their annual GDP. So the cost of a pandemic, and we know that it is only something that is coming, that there will be an outbreak, that there will be a pandemic. And we are very aware that the cost of such a pandemic could be overwhelming to the economies, not only of the African region, but indeed of the whole world. The World Bank estimates the economic impact of a severe pandemic would be nearly 5% of the global GDP, that is roughly $3 trillion. And another estimate indicates that during the 21st century, global pandemics could cost more than $60 billion per year. This is the kind of loss of economic strength that the world cannot afford, and particularly our African region. With the large number of disease outbreaks and emergencies that we routinely see in our region, African countries certainly need national systems that are better prepared and are resilient enough not to be overwhelmed by public health events. We know that the common determinants of some of these, such as inadequate access to safe water, poor sanitation, overcrowded housing conditions in our cities, lie outside the domain of the health sectors, and many are linked to the low socioeconomic status of communities. And we therefore recognize that this work requires multi-sectoral action. It is not just the ministers of health that are going to make the difference. For example, our observation is that it's often gaps in water and sanitation that cause the many cholera outbreaks in our country to continue for many, many months before being controlled. And we recognize now that the urban context in which many of these outbreaks are occurring, not only the Ebola outbreak in West African cities, but the yellow fever outbreak that is just coming under control, which was in Luanda, primarily in Angola, and in Kinshasa, in the Democratic Republic of Congo. These demand even more investment in the robust types of health systems that will be able to control and contain these outbreaks at the start. Chronic underinvestment, as the President has just said, and in addition to that, inefficient allocation of resources over decades has left health systems in most of our countries not capable of delivering basic preventive and curative services to their citizens, including controlling disease outbreaks. While public expenditure per capita for health has increased from about 70 to 160 US dollars per capita since 2001, when the Abuja Declaration was adopted by our heads of state, many countries are still below the 86 US dollars per capita that is now recommended by WHO for the delivery of basic health services. And we note that countries in protracted crises like the Democratic Republic of the Congo, for example, and the Central African Republic are spending only around $12 per capita. This is not going to help to fix our broken health systems. So how prepared are we to face up to the next major epidemic that can come forth? In order to prioritize, first of all, and tailor our epidemic preparedness support to countries, especially in the context of the Zika outbreak, WHO Africa carried out a regional risk analysis and mapping, which was based on previous outbreaks that had occurred in countries, the ecology in countries, including the presence of vectors and the capacity of the health systems in countries. This is what is guiding our support to countries in the context of limited resources. The most frequently occurring outbreaks are of cholera, of meningitis, viral hemorrhagic fevers like Marburg, and of course Ebola and Lassa fever, dengue, yellow fever, malaria, and Rift Valley fever. So in terms of how prepared we are, first of all, some good news, I think. There is no doubt that the post-Ebola outbreak preparedness and control capacities are very different in Guinea, Liberia, and Sierra Leone than they were before, as has been shown by the swift control of Ebola flare-ups in these countries after the bulk of the Ebola outbreak was finished. Capacities for surveillance, for early warning, case detection and reporting at community, very importantly, district and national levels have improved in these countries. National and district or county emergency operations centers have been established, a multi-sectoral coordination which is so important because preparing for and responding to public health emergencies goes beyond the health sector alone, are working better. And I'd like to say here a thank you to the African Development Bank for the support that you've provided with other partners to these countries to show up and improve their capacities. So this is a positive story, bought at a very high price with the tragedy of the Ebola outbreak. In addition, 19 priority countries around the Ebola epidemic, mainly West African neighboring countries of those affected countries, were supported by WHO and partners to improve their capacity for surveillance, for early detection, and for rapid response through coordinated action. They are certainly now more aware of the risks of outbreaks, and are somewhat better prepared to control them, as we've seen through the rapid containment of recent outbreaks of Lassa fever in Benin and in Togo. But I have to emphasize, we noted that much of the work in improvement has been done with international funding, emphasizing the need for domestic investment in our systems. However, taking the WHO African region as a whole, there remain major gaps in preparedness and health systems resilience to adequately respond to and cope with the impact of the emergencies. In fact, none of the 47 countries in our region has achieved the core capacities required to fulfill their commitments and obligations under the international health regulations. Ladies and gentlemen, the Ebola tragedy has brought also great opportunities, and I'm very happy to see that the countries in our region are seizing on these opportunities. For example, a global coalition of countries, including the G7 countries, within an initiative called the Global Health Security Agenda, are supporting international health regulations capacity building, starting with independent evaluation and identification of critical gaps in our countries, which will be the basis for developing and hopefully investing in national improvement plans. These plans will require additional financial resources, importantly, domestic resources, as well as continuing international support. Strong partnership is required to prevent and mitigate the risk of outbreaks. And we are very pleased that the ongoing collaborative work with regional bodies like ECOWAS, SADC, and the East African Community, as well as with the African Union Commission on the establishment of the Africa CDC, are envisaged to further strengthen the preparedness and response capacity in Africa. The role of the private sector, which is a major provider of healthcare in the region and which is a major investor in the health sector, also needs to be further defined and developed, and we are very encouraged by what you said, Mr. President, about your recognition of this importance. So most countries in the African region need increased and sustained investment to strengthen their health systems. So this is where the ministers of finance, as well as the ministers of health, are going to come in. We are aiming to have countries where health infrastructure, including primary care clinics and health centers, with the required equipment and supplies, with trained health workers, functioning data systems, effective community mechanisms, are in place in all parts of countries, so that disease outbreaks don't expand silently without being noticed by those who need to take action to control them. This is what happened in the Ebola outbreak in West Africa. Also, we need health systems where families are not impoverished due to out-of-pocket payments when they have to access healthcare services. African countries have strongly embraced universal health coverage as a central tenet for achieving the Sustainable Development Goals, and the financing to accelerate progress towards UHC is required. So again, domestic financing for health and more effective investment are needed. For example, we've observed that even as countries are increasing their investment, much of this money is going into tertiary hospitals, which are mainly in urban areas, and relatively little is going into primary health care, reaching the most remote areas where outbreaks can silently spread without being aware of them. So increased investments on preparedness, including on the capacities for the international health regulations within resilient national health systems, and as a core part of national development, and dare we say national security plans and budgets, is necessary. Pandemic prevention requires strong core public health functionality to detect potential outbreaks early, to ensure correct diagnosis, and to respond rapidly to stop spread. The World Bank has estimated the cost of this essential, permanent, global infrastructure at $3.4 billion per year for all developing countries. The expected benefit of better preparedness is at least $37 billion a year, though, making such infrastructure a profitable use of public funds. The economic gains of return, the economic rates of return on investment in public health and strong health systems range from 50 to 123% per year, depending on the disease risk. I'm very confident that ministers of health are ready to make the case to ministers of health, to parliamentary committees for health, and to national decision makers at the highest level for this investment, which we think is a good buy, even a best buy. We're also extremely hopeful that ministers of finance and the parliaments, despite juggling many competing priorities, will decide in favor of this good buy for national security, for development, and for the prosperity for which all African people and governments are working so hard. Today's world is absolutely interconnected, and it demands that countries work hard, work together, including across borders, to live up to their commitments within the international health regulations, that is, stopping outbreaks at home and preventing the international spread of epidemics. International solidarity needs to be central to addressing collective vulnerability, but this starts at home with domestic investment and financing. We in WHO are ready to work with our member states and with partners, including with the African Development Bank, to support countries to provide the policy advice, the technical support needed to establish resilient health systems and to improve outbreak and public health emergency preparedness and response. And I'm very happy to have come to this dialogue and look forward to an extremely productive and rich exchange of views for the rest of today. Thank you very much.
Thank you, Dr. Moeti, for letting us know that we do have our work cut out for us if we're to find the billions needed to create resilient healthcare systems. Now, we saw some of that from Ivory Coast, because Ivory Coast, of course, found itself surrounded by Ebola, but did not succumb to the virus, proof of an alert and robust healthcare system. So there is much to celebrate and to learn from our host country. And so, Prime Minister Duncan, welcome.
Monsieur le Président de la Banque africaine de développement, Mesdames, Messieurs les ministres en charge de la santé et des finances, Madame le directeur régional de l'OMS Afro, Monsieur le directeur général de l'Organisation ouest-africaine de la santé, honorables participants, Excellences, Mesdames et Messieurs, c'est avec un réel plaisir que je réponds à l'aimable invitation du président Dessina, président de la Banque africaine de développement, à prendre part à l'ouverture de cette réunion de haut niveau consacrée à la sécurité sanitaire dans notre sous-région en lien avec les maladies à virus Ebola et Zika. Il s'agit là d'une thématique au cœur des priorités du président de la République de Côte d'Ivoire, son Excellence M. Alassane Ouattara. C'est pourquoi je voudrais, Monsieur le Président de la BAD, vous saluer pour l'initiative de l'organisation de cette importante tribune d'échange. J'adresse aussi mes salutations chaleureuses à toutes les hautes personnalités venues, notamment de la Guinée, du Libéria et la Sierra Leone, afin de réfléchir ensemble sur les moyens de renforcer nos systèmes de santé. Honorables participants, Excellences, Mesdames et Messieurs, il n'est un secret pour personne que notre sous-région a payé un lourd tribut à l'épidémie de la maladie à virus Ebola, on en a parlé tout à l'heure, avec plus de 11 000 personnes décédées, sans compter les graves conséquences socio-économiques qu'elle a induites. Ce drame a en outre mis en exergue la nécessité de remédier à la faiblesse de nos systèmes de santé et la nécessité parallèle de développer les stratégies pour apporter des réponses urgentes aux situations de crise sanitaire en déployant des moyens, bien sûr matériels, mais aussi financiers et humains adéquats. Car par-delà l'épidémie d'Ebola et la menace potentielle de la maladie à virus Zika, il se pose à nos pays africains la question essentielle de la capacité de résilience de nos systèmes de santé face aux menaces et aux crises sanitaires. Nous partageons avec la BAD l'idée que deux des domaines cités pouvant impulser l'atteinte de nouveaux objectifs de développement durable, l'ODD, dans nos pays concernent 1. L'accroissement des revenus et d'investissements pour la santé. 2. La nécessité de faire de la réussite de la couverture maladie universelle une priorité nationale pour nos pays. Sur ce point, et coïncidence heureuse, je crois que le président Labad en a parlé tout à l'heure, je dois me rendre à Yamoussoukro juste après cette rencontre avec Madame le ministre en charge de la santé et de l'hygiène publique pour présider l'ouverture d'un symposium international sur la couverture maladie universelle organisé par le gouvernement ivoirien. Au niveau de la Côte d'Ivoire, la couverture maladie universelle devra commencer à être opérationnelle dès le début de l'année prochaine, en 2017. Le président Labad a eu raison de signaler qu'effectivement, nous allons commencer par les étudiants. No comment. Oui, il est plus qu'urgent pour notre pays de mettre en place des stratégies et mécanismes collectifs de solidarité susceptibles de garantir l'offre et l'accès aux soins, afin de réduire la vulnérabilité des couches les plus défavorisées. Conscience de cet état de fait, la Côte d'Ivoire, sous la haute égide de son Excellence M. Alassane Ouattara, président de la République, s'est engagé à investir davantage de ressources financières pour renforcer son système de santé avec la prise en compte des défis liés aux nouvelles menaces sanitaires. Il est vrai que nous sommes encore loin des objectifs d'Abuja 2001 qui imposent de consacrer 15% des budgets nationaux à la santé. N'est-ce pas, Madame le ministre? La santé. Elle ne manque pas de nous rappeler ça à chaque fois. Mais au sortir de la crise, la part du budget de la santé, qui était de 3,46% en 2011, a connu une évolution régulière à la hausse pour atteindre 5,70% en 2015, même si on a constaté une légère baisse en 2016 avec 5,58%. L'objectif du président de la République, Alassane Ouattara, est de maintenir la tendance à la hausse. C'est ainsi que le budget prévisionnel de l'année 2017 connaîtra une hausse de l'ordre de 12,55%, ce qui cependant ne représentera que 5,68%. Malheureusement, ça ne suffit pas. N'est-ce pas, Madame le ministre? Toujours au titre du mécanisme de financement de la santé, et en plus de l'appui de nos partenaires techniques et financiers, le gouvernement ivoirien encourage vivement, et le président a décidé d'en parler, le secteur privé à participer de plus en plus aux investissements dans ce secteur, en termes de construction et de réhabilitation d'infrastructures, de fourniture de matériel, d'équipements et de médicaments, entre autres. Dans ce cadre, les partenariats publics et privés sont des voies de financement que la Côte d'Ivoire veut renforcer pour accroître l'offre de services de santé en quantité et en qualité. Enfin, je tiens à saisir l'opportunité que m'offre votre tribune pour faire un plaidoyer au nom du président de la République, son Excellence M. Alassane Ouattara, en faveur de la création d'un fonds d'urgence de lutte contre les pandémies. Je sais que vous allez discuter tout à l'heure, peut-être pour examiner cela. Je voudrais indiquer en matière de nutrition que vous avez tenu une table ronde ici, à Abidjan, qui a été très très forte. Il fallait donc rechercher 267 milliards de francs CFA. 40 milliards avaient été apportés par l'État ivoirien et 227 milliards apportés par les partenaires extérieurs. Je voudrais à nouveau me permettre de féliciter tous les partenaires, puisque nous avons presque obtenu le double des montants indiqués avec 177% de couverture. C'est vous dire que la communauté internationale peut être généreuse quand peut-être les dossiers sont prêts. Voilà, on m'a indiqué qu'il ne fallait pas être trop long. Donc je voudrais donc terminer mon propos sur cet appel que je voudrais conclure mon propos en souhaitant un plein succès à la réunion de haut niveau sur le renforcement de la sécurité sanitaire en Afrique. Merci encore une fois de votre aimable attention. Thank you.